Hi guys, this is chapter one of your pharmacy technician. I actually be showing you my book where I have things underlined and starred and um, things that will be important. I thought it would be a great thing to use my book to show you these things that may and probably will be seen in the near future. So let's get to the next page, page 3. This is your work duties and responsibilities. This is not terrible, but they do ask a lot of questions because they need you to know what you should be doing. Pharmacy technicians are healthcare workers that generally work under direct supervision of licensed pharmacists. That means you will always be up under a pharmacist. A pharmacist should be somewhere around when any pharmacy technician is working. You have to pay attention to detail, accuracy, and interpersonal skills. General duties for the pharmacy technician. You will be receiving written prescriptions and or refilling requests, verifying patient information, filling bottles, labeling, compounding, pricing, filling prescriptions, mixing, maintaining storage conditions, regularly checking up and outdated expiration dates. So you will be checking your meds always, even as nurses, we do that as well. Make sure we're not giving out outdated, expired medications. Clean and maintain equipment, work areas, ordering and labeling medications. So, yes, you might be ordering and also, of course, labeling medications, supplies, making sure you're looking around if any supplies are needed. You also may be unpacking your orders. So, you're kind of jack of all trades. You're going to be up at the retail in the front, taking monies. You may be in the back stocking. Um, Doing all the above. Might be filling orders to be taken somewhere. Some of your pharmacists actually drive their medications to their patients, so it depends on where you're working at. Um, you may be answering the telephones, assisting customers, establishing and maintaining patient profiles. You will be asking these people, what's your insurance? What's your name? Yeah, sometimes they need proof. Sometimes they need a written prescription. All of the things that you would know, and they'll be able to assist you and telling you those things. And wherever you plan on working, it's going to be a different protocol for each one. You may receive and store supplies according to manufacturer's instructions. So some may need to go in the refrigerator. Some needs to go, um, in a dry place or in a certain temperature. However they are, that's what you're going to and store your medications. Preparing and processing medical insurance forms. A lot of times people are just new to the pharmacy, so you'll have to get more information. Sometimes when your people come in and you know them, they only have to show their ID and then you can look them up. They're already in the system. But you'll have to be able to do that. You generally do not advise patients on medications. You'd like your doctor to do that. But you may also be able to tell them about some of the over the counter medications. Pharmacy technicians who work within retail pharmacies may also be responsible for inventory. And that's just keeping up with your medications. If one's running out, get and invoice it and get them some more. Operating a cash register, pricing medications, assisting customers with questions. You know how it is when you go to the counter. Sometimes you want to know what in the world is this medicine for, but that the doctor called in for you. They should be able to explain that and or tell you to read the instructions slip that comes with it. And a lot of times that's what you rely on because it's going to have an information sheet with it. Um, Pharmacy technicians working in a hospital, you may be transferring medications from vials to syringes, and that's just depending on where it's headed. You may have to put it in liters of water, um, and that you'll see when you go to work at a big hospital. Adding measured drugs for nutrients and IV solutions. That's also part of a pharmacist's job. Dispensing prescription drugs is generally the responsibility of whom? The pharmacist. So the wording is what you need to pay attention to here. Dispensing prescription drugs. What you're doing is preparing and doing all that stuff, but he is ultimate responsibility, the pharmacist. But also may be a duty of the pharmacy technician. So the big words are dispensing is generally for the pharmacist. The pharmacist is also responsible for any procedure involving professional discretion. So if there's any questions, anything that you don't know about, you don't just figure it out. You ask someone, and that someone should be your pharmacist. When filling prescription drugs, the pharmacy technician must verify the information of the patient, the insurance policy, and the prescription. So you got to verify the information of the patient and verify their insurance. Make sure the prescription is what it says, and it needs to be properly labeled. If it's none of that, then you don't need to be handing out any medications. Let's go to the next page. As you see, I've underlined and starred, so you will know what is wonderful and amazing to remember. So these are your hints and clues. Along every word is important, but those are the ones. If you were in class, we would be saying the same things that I'm saying to you here. Labeling medications properly includes listing the name of the medication, the dosage, and the price. So you may be labeling, should be labeling anyways. If they're not already labeled, you'll have to carry that label over to the bottle so it can be on the separate bottle as well. Normally, medications come in big giant bottles with 1,000 pills in them. So you'll be the one to pull out, count, process that, and put them into the smaller bottles for your patients. The pharmacy technician must always be aware that mixing must be accurate at all times. Inaccurately mixed medications may be serious effects on the patient. If you're asked to mix anything, you should have a very good training before you do that, because we do not teach that here. We learn some of the calculations that might go along with that, but we're not actually doing the mixing. So let someone make sure they show you how to do that. When processing a refill prescription, it's always necessary for the pharmacy technician to check if refills are available. So before you even fill in anything or fill a prescription, you need to check if you can. That patient may not have any more refills, and just coming and seeing if they do. A lot of times they'll tell them to go see their doctor first before they can get another refill. Once a prescription is filled by a technician, the pharmacist will check the prescription. Who is ultimate responsible? Who is going to check your work? It is the pharmacist. Prescription filling process. Patient drops off prescription and the pharmacy technician ensures that the prescriptions are correct. First off, you want to verify the information. Make sure that it has the patient name, medication, dosage. That physician's signature is very important, and your refill information. If they want it refilled 3 times, it should say that on that prescription. Um, Make sure that everything is going along with that. If there are any discrepancies, the pharmacy technician may contact the prescribing physician. So, can you call a physician and say, "Hey, I really can't read this"? Yes, you can. Um, that is part of your job. A lot of times you'll get to know that person's handwriting after a while. Um, so you'll be able to verify that by calling. Um, Make sure you know the date of birth, address, insurance, all of that for your patient as well. Enter prescription into the computerized system. Some pharmacies may have digital image scanners, which is wonderful. Just like when you go to the grocery store and they scan that medication or your Tide, it's the same thing. They go through with that scanning process. Um, you also want to make sure if there are any interactions between drugs. Some drugs cannot be taken together, and that's when you want to notify or warn your pharmacist that there's something going on. Let them make that decision. Pharmacy technicians may access databases, which is a whole lot of information about that patient, mostly about medications, when they last had it, when they what type of insurance they had. Um, all that can be just pretty much typed in as soon as you type in their name, sometimes up under a social security number as well, or phone number, depends on the store. Know this definition. The term nomenclature is often used to refer to a list of names or procedures. That's all. So they'll say the nomenclature is, and they'll be talking about procedures such as some type of surgery. and they give it a fancy name, but that is what it's called. The term nomenclature is often used to refer to a list of names or procedures. The copayment is designed or decided by the insurance provider. Sometimes they have to pay $2. Sometimes they don't have to pay anything. Sometimes they have to pay $20. It really depends on their insurance, and you will have to collect that before you give them medication. Once the prescription entry is complete, place the medication into the bottle and label according to federal and state regulations. The pharmacist, again, do you see how many times just in these two little pages we went over? The pharmacist makes the final check by verifying medication name, dosage, directions, and patient name. So, what needs to be on there? The name of the medication, the dosage of the medication, the directions to take that medication, and of course, the patient name. Patient signs a signature log if they have one. A lot of times it's just the pad that's on the computer that where they pay. But it is their signature log for legal purposes, showing prescriptions that they have received it. After verification, the prescription is given to the patient. I also have this start and wrote in here negligence would mean not doing those things correctly. If you do not do any of those things above correctly, they're going to call it negligence on your part that you did not follow everything. You did not verify. These are medications you have to verify before they go into a bottle. Things get fast. People make mistakes. You have to verify, or you can kill someone. So make sure it could be the best job of your life, but you've got to be and pay attention to details. Inventory, you may have to do that as well. Adequate inventory is defined as basic stock and safety stock. Basic stock is the amount of inventory that is carried to meet an average demand. Safety is the amount of inventory that is carried to account for fluctuations. Basic is what we have on hand all day. Safety is just in case something happens. We got a little stock in the back room back there that can handle the extra demand. That's the difference in basic and safety. There are there are different inventory systems. They're based on perpetual inventory system or periodic inventory system. Perpetual inventory system means continuous record of inventory. That means you gave out 20 pills. It tells you gave out 20 pills, and it's pretty much computer regulated the best way to do it. Or it's even handwritten that each time you open this bottle, you're going to account for each pill that comes out of this bottle. That's your perpetual. Then you have periodic inventory system, and it's where they count and inventory updated on a periodic basis. It really depends on where you work. And narcotics are more perpetual, where some of the other medications are more periodic. Customer care. Customer care is important for any pharmacy technician because of the daily interaction with patients. The pharmacy technician must be able to establish and maintain good interpersonal skills, assisting customers by answering questions, helping patients as part of your daily routine, appropriate manners, and ethics. You've got to your customer service, your front line. Sometimes you are the person in the back, but a lot of times you are the one that is there, um, getting their medications, doing the whole little process for their medications. Okay, next page 5. Work settings. It really depends on where you work. Um, Pharmacy technicians can work in a variety of settings. One is your hospital pharmacy. The hospital pharmacy is more focused on pharmacy service to the hospital. Some may have more complex. It really depends on where you're going. A lot of times they put meds into a certain patient name, and those meds are singly wrapped for that patient for that day. Depends on where you work. It may be for the whole week, but it's most of the time it's singly wrapped. It depends on where you're working. In general, hospital pharmacies stock larger amounts of medications because there are more people there. Although hospital pharmacies do not usually tend to the public, some may have retail stores even in there as well. Internet pharmacy. An increased number of internet pharmacy has been established in the past decade. Internet pharmacies are similar to community pharmacies. All that is you can call, talk sometimes to a doctor online. Sometimes they do face to face, they do Zoom, they do all the things that you can do to speak to a doctor. Sometimes it is just verify your information and a doctor prescribes you something. And that is more your internet, less drugs that can affect you or have less interactions that they can do over the internet. And a lot of times they're not even in this country because, here in America, most of our medications, you're going to have to go to a doctor to get a prescription. For a prescription to be valid in the U.S., it must be issued for medical purposes by licensed healthcare workers such as physician or registered nurses. And most of the time, it's going to be a nurse practitioner or a physician's assistant or a physician. In general, the importance of prescription drugs violates importation of prescription drugs violates FDA laws and regulations. All that's saying is that we don't do that. We do not see a patient and order them something. And that's all that's trying to say is, in general, the importation of prescription drugs violates FDA laws and regulations, because if they're coming from another country and have not been checked out by the U.S., it is not clear, and it may not work, or it may kill you or someone else. So you got to watch out for your internet pharmacies. They are out there, and you can just order some meds that normally in the U.S. you would have to see a doctor for. Next page. Turn your page. Your community pharmacy. That's the one a lot of y'all would be working in, probably most familiar with, known as a drugstore, retail pharmacy. About 75% of pharmacy technicians work there. A community pharmacy is a pharmacy in which a dichotomy of professional exists, meaning health professionals are also retailers. That's all that word means. I don't think there's a definition where you have to remember that, but that is all it's saying is that they're both. They're both a entrepreneur owning a business as well as a pharmacy technician. Nursing home pharmacy, pharmacies that provide services to nursing facilities. It really depends on, again, where they're at, what you'll be doing. Could be infusion therapy, could be giving supplies. Um, really depends on your part that you play in that facility. Federal government settings, of course, you should know about the FDA, which is the Food and Drug Administration. You can work there as well. Drug enforcement agencies, U.S. Public Health Services, Center for Disease Control, military, Department of Health and Human Services. Um, It really depends, because you can go to the VA right now. They've got a pharmacy in there. I would normally call it like a hospital pharmacy. That may be the military, but it all boils down to the same things. You're going to have to make sure you know about these meds, know your names, know exactly what you're putting in those bottles, and to whom you're giving them to. Next, for education and training. Your certificate here is for MedCa. It is called a CPHT or CPT, which is coming from MedCa. You're a certified pharmacy technician. You have to renew your license every 2 years. Also, remember to get your license, the test is $130. Um, they are If you fail the first one, which you're not going to, the next one is $140. I think I can actually get that back down to 125. We're going to figure that one out, but do make sure you have that. Got to recertify every 2 years. The pharmacy technician certification exam, your requirement should be high school diploma, no felony convictions, no drug related. If you do have any such things as that, you actually can get your certification, but you will have to answer for that when you get your jobs. So, because we're dealing with medications, they're going to dig a little deeper, especially drug related. Don't want you in there um, giving out meds or taking them. So if you have anything like that, hopefully you have some rehab, something documented, something like that, that you can say you were young and dumb or you've been through rehab, something. And I'm just put that in there. Exam developed to assess skills. Main subjects of the exam are maintaining medication, assisting pharmacists, assisting patients, and administration of pharmacy practice. So, not terrible section there. Education and training. Turn to our next page, which is our last page for chapter 1. It's called infection control. Of course, this is a wonderful, wonderful time to talk about this. Infection control is a very important issue within pharmacy settings simply because the pharmacy dispenses medication to the public. Contamination of those medications and or other drugs produces and can cause serious effects. So you are going to protect yourself and you're going to protect yourself from the medication because it can ease into your skin. You're going to protect that patient from having any germs, bacteria on those medications. Personal hygiene, main aspects, you want to wear clean and proper attire. Wear gloves and masks if necessary. Sometimes masks are not, gloves are always necessary. Make sure you disinfect your hands. It's also best to fill and turn faucets using a clean paper towel. So get you a clean paper towel and turn on that faucet instead of retouching that faucet. General guidelines, pharmacy must be kept clean at all times. Pharmacy employees must maintain personal level of cleanliness. I'm so sorry, y'all. My tongue gets tied, and cleanliness is one of those words that will tie it up. Um, Pharmacy employees must maintain personal level of cleanliness and hygiene. Work areas and countertops must be wiped down with disinfectant at least once daily, and now it's more than that. Equipment and utensils must be sterilized. Any spills must be cleaned up immediately. Pharmacy employees must be free of active infections. You don't want to be putting infections on people's pills that they're about to put in their mouth. Frequent hand washing to reduce the risk of spreading infection. All medications must be stored properly. Monthly inspections should be conducted. So, how many times are we going to inspect? Most likely monthly. Medications must be returned to the inventory if they are in sealed containers so that pharmacy integrity is ensured. If they are not, they do not come back to the pharmacist, they destroy them. Medications that are returned by patients unsealed shall be accepted back and disposed of. That's the main wordage there. We want it disposed of. If it's not been opened, if they can tell it's not been opened, they'll expect get it back. If it's pill bottle, probably not. They're getting disposed of. Medications that has been handled in any way by patients should not be returned to the inventory. So most of the time they just throwing away the medications anyway. So just um, do not let them bring their medications back. And if they do, you do not use them. All right, that's the end of chapter 1. I'm so excited for you guys. Chapter 1 is down, and that's it. Make sure you study that. Keep studying your medications, they do not go away. And soon I'll have some practice questions up for you for this chapter.